Good morning and welcome to Medicaid 101, Understanding Medicaid. During this presentation, we will provide an overview of the history of the Medicaid program. We'll describe the differences between the Medicaid and Medicare programs. We'll share about Medicaid governance, including both the state's role and the federal government's role. We will discuss who is eligible and what is included in the Medicaid program. We'll talk briefly about Medicaid financing and provide you with an overview of the various services in Medicaid. Finally, we'll describe our role and how CDCN fits into the Medicaid picture. Overview and history of Medicaid. Authorized in the Social Security Act, Medicaid was signed into law in 1965 alongside Medicare. All states, the District of Columbia, and the U.S. territories have Medicaid programs designed to provide health coverage for low-income people. Although the federal government establishes certain parameters for all states to follow, each state administers their Medicaid program differently, resulting in variations in Medicaid coverage across the country. One thing to note is that Medicaid does not provide the care. Instead, it pays professionals, in this case providers, to deliver the care. In FY 2019, total Medicaid spending was $616 billion. When learning about the Medicaid program, it is very important to understand the Medicare program. Both of these programs were initiated in 1965 through the Social Security Act. Millions of Americans rely on these government programs to help provide them with essential healthcare services, and both play key roles in covering healthcare costs. Oftentimes, however, the programs can be confused. Today, let's explore some of the important differences between both of these programs. Let's start with Medicaid. Medicaid is a healthcare service program specifically designed to help cover medical costs for people with limited income and financial resources. Medicaid covers a wide variety of people who are in financial need and therefore eligible. Some of the services covered under Medicaid include hospital services, doctor visits, medical testing and procedures, prescription drugs, and medical equipment. As well, it's important to note that Medicaid covers many long-term care alternatives, including nursing homes, assisted living facilities, as long as the care is deemed medically necessary. How is Medicaid funded? Medicaid is a jointly funded federal and state government program managed by the states. the federal government's funding contributions comes with strings attached that require states to provide certain benefits. States, however, do have the option to establish optional benefits to their Medicaid programs, and this varies from state to state. Now let's learn a little bit about Medicare. Medicare is a health insurance program for anyone with a qualifying work history who is 65 or older, as well as certain younger people with certain disabilities or end-stage renal disease. Income and financial assets are irrelevant to qualify for Medicare. As long as you have worked for 10 years at a job in which you paid Medicare taxes, you'll generally qualify. Also, if you're married and your spouse fulfilled the 10-year work requirement, then you can usually receive Medicare benefits as well. Some of the services are slightly limited in the Medicare program. They might include hospital services, doctor visits, medical testing and procedures, prescription drugs, and medical equipment. There is limited coverage for long-term care in the Medicare program. One important difference between Medicaid and Medicare is that Medicare is 100% funded, administered, and managed by the federal government. Oftentimes, there are citizens who may have financial challenges and can sometimes get coverage under both the Medicare and Medicaid program. Medicare is designed to cover only a portion of healthcare costs. So in this case, citizens considered dual eligible can get assistance with some of the premium and copayment costs that Medicare charges, and Medicaid can fill in gaps that Medicare won't cover. How is Medicaid governed? Let's take a moment to explore the role of the federal government and state government in the Medicaid program. When learning about Medicaid, it is very important to understand the role of the federal government and the states in managing the program. Medicaid is administered by the states according to federal requirements. Federal laws and regulations are administered by the Centers for Medicare and Medicaid Services, or as we call it, CMS. CMS specifies core requirements all states must meet to receive federal funding. So let me tell you a little bit about CMS. CMS is a division of the Federal Department of Health and Human Services. They provide health coverage to more than 100 million people through Medicare, Medicaid, the Children's Health Insurance Program, known as CHIP, and the Health Insurance Marketplace. CMS's primary goal is to strengthen and modernize our nation's healthcare system by providing access to high-quality care at lower cost. The Department of Health and Human Services, HHS, is administered by a secretary and CMS by a director, both of which are appointed by the President and confirmed by the Senate. So what's the state's role in the Medicaid program? The states use federal guidance to define how they will run their program. All state programs are subject to review and approval by CMS. However, states have the flexibility to administer the Medicaid program respective to their state needs, meaning they can determine eligibility levels, benefits, provider payments, delivery systems, and other aspects of the program. It is important to note that the states must have a single state agency that administers Medicaid. The basic tenets of Medicaid are founded on two principles: entitlement and the federal-state partnership. Entitlement is a federal program or provision of law that requires payments to any person or unit of government that meets the eligibility criteria established by the law. In this case, entitlement goes to eligible individuals who are entitled to a defined set of benefits, whereas the states are also entitled to federal matching funds. Of course, what is very important about Medicaid is the federal-state partnership. The federal government sets core requirements on eligibility and benefits, and they offer to the states the flexibility to administer the program within federal guidelines. As we have noted, the states are provided with federal guidelines in establishing their own Medicaid state plan. Everything that happens in the state under Medicaid has to be approved through the Medicaid state plan. The Medicaid state plan describes the program, and it also describes how the program must be operated in accordance to the state plan, approved by the federal government. The state plan outlines which groups of individuals are to be covered, which services are to be provided, the methodologies for which the providers are to be reimbursed, and any administrative activities. As noted, states must submit and receive approval from CMS of a state plan amendment to change how its Medicaid program is operated. So far, you've learned how the Medicaid program is administered and the role of the federal government and the states in administration of the Medicaid program. Now let's learn a little bit about eligibility and coverage in the state plans under Medicaid. As we've noted thus far, Medicaid's focus is individuals who have limited income and financial resources, regardless of age. Medicaid is incredibly unique in that it covers more Americans than any other health insurance program. Medicaid recipients must be U.S. citizens or legal permanent citizens. It covers a wide range of people, from those that are age 65 or older, individuals with disabilities, children 18 and under, adults caring for a child, and adults without dependent children in some areas. Services covered under Medicaid are things like hospital care, post-hospital extended care, and home health coverage to almost all Americans age 65 or older. This graphic provides you with a great viewpoint of how Medicaid plays a critical role in our health delivery system. One important and critical aspect about Medicaid is that it supports our healthcare system and safety net. It provides health insurance coverage for 1 in 5 Americans. It provides incredible assistance to over 10 million Medicare beneficiaries, and it allows the states to have the capacity to address health challenges. It also provides an incredible amount of coverage for long-term care financing programs that are important for the elderly or those with intellectual and developmental disabilities. Medicaid plays an important part in covering our nation's health system. So, how does someone qualify for Medicaid? There are certain criteria that have to be met before you qualify for Medicaid. First is a general qualifying criteria, which is citizenship. You must be a citizen of the United States in order to qualify for the program. There are certain non-qualified citizens that also qualify. You must meet a categorical eligibility, which is people must fit into a predefined group of individuals, mandatory or optional. We'll discuss this one a little bit later in our presentation. There's also financial criteria. People must also have income below defined limits. This is usually set by the federal poverty level. As we noted in the previous slide, there are two Medicaid eligibility groups. These are mandatory and optional. Mandatory groups are groups that a state must include if they participate in Medicaid. These include pregnant women, children, parents, elderly individuals, and individuals with disabilities. There's also optional eligibility groups. These are groups that a state can choose to include. This includes all medically needy groups and also includes childless adults and mandatory groups above income thresholds. By this point, you've learned who Medicaid covers. Now let's learn what Medicaid covers. Once a person comes into Medicaid, they have access to all of the services that the state covers and are medically necessary. This can include such things as medical and doctor visits, hospital visits, or prescription drugs. Services must be statewide, comparable, delivered with reasonable promptness, and allow individuals to choose providers. States can define the amount, duration, and scope of services to reasonably achieve their purpose. There is one interesting note about Medicaid coverage, and that is the early and periodic screening, diagnostic, and treatment program. This is for children under 21 and allows them to get all medically necessary optional and mandatory services, regardless of whether the state covers them for other individuals. As we have noted, Medicaid can cover a variety of services. However, it is important to note that those services are deemed either mandatory or optional. All states must provide a core set of what the Medicaid program calls mandatory services. These services might include benefits such as physician services, laboratory and X-ray, family planning, or home health care services for individuals entitled to nursing facility care. In addition, states can choose from a list of optional services that they would like to offer as part of their Medicaid program. These can include prescription drugs, dental services, physical, occupational, and speech therapy, dentures or eyeglasses, home health care services, personal care services with options to self-direct, or hospice care. How is Medicaid financed? Understanding Medicaid financing can often be incredibly complicated and complex. However, we'll try to give you a brief snapshot of how Medicaid is financed throughout the United States. Medicaid is publicly financed but is not a government-run healthcare program. The federal government, through the Department of Health and Human Services, pays states a percentage of money for medical services paid by Medicaid. This is called the Federal Medical Assistance Percentage, or as we commonly call it, the FMAP. Percentages are different for each state and cannot be less than 50%. One of the programs through Medicaid is the Home and Community-Based Services Program, or as we call it, HCBS. Nationwide, Medicaid finances $55.8 billion through HCBS programs. State Medicaid programs have historically paid for services through two models, or a combination of the two. Fee-for-service, which is a method in which doctors and other healthcare providers are paid for each service performed. Examples include tests and office visits. The second is risk-based managed care. This is where enrollees receive most of their health care through an organization under contract with the state. Let's take a moment to review the various services under which Consumer Direct Care Network provides care through Medicaid. Consumer Direct Care Network operates under Long-Term Services and Supports, or as we commonly refer to it, LTSS. LTSS encompasses a variety of health-related, and social services that assist individuals with functional limitations due to physical, cognitive, or mental conditions or disabilities. Long-term services and supports includes institutional care, such as nursing homes, as well as home and community-based services, HCBS, such as personal care, adult day, home-delivered meals, and transportation services, as well as institutional services such as nursing homes. Services may be defined through a state plan authority, waiver authority, or a combination. In this case, Medicaid is the primary payer, not Medicare nor private insurance. At Consumer Direct, our services are mostly provided through Medicaid waivers. As we've already learned, federal Medicaid law sets broad requirements for the program and mandates coverage of some population and benefits, while leaving many optional. As we learned, states have the authority to make many operational and policy decisions that determine who is eligible, which services are covered, and how payments are set. States seeking additional flexibility can apply to the Secretary of HHS for what's referred to as Medicaid waivers. These are a waiver of certain statutory requirements. For example, states can request a waiver of provisions requiring service comparability, statewide-ness, and freedom of choice in order to offer an alternative benefit to a subset of Medicaid beneficiaries. In exchange for the flexibility offered by waivers, states must meet budgetary criteria and provide regular reports and evaluations to CMS to show that the requirements of the waiver are being met. At Consumer Direct, we primarily focus on the self-directed model of care. As noted, our services are approved and provided through Medicaid waivers. There are several waivers under which the option to provide self-directed services is available. These include the 1915I HCBS State Plan Amendment Waiver, the 1915K or Community First Choice State Plan Amendment, the 1915J, the Self-Directed Personal Assistance Services State Plan Amendment, the 1915C HCBS and 1115 Demonstration Waivers, and the 1115 Research and Demonstration Project Waiver. We currently provide services under these waiver authorities, and in some cases under multiple waivers, depending on the state. You might remember we mentioned two ways in which Medicaid can be financed: fee-for-service and risk-based managed care. We provide services through managed care in several of our states. But here's a little more detail on the managed care system. Managed care is a health care delivery system organized to manage cost, utilization, and quality. States can contract with managed care organizations, or as we refer to them, MCOs, to deliver Medicaid healthcare services. In our space, we refer to this as Managed Long-Term Services and Supports, MLTSS. Here's a few statistics about managed care in the United States. As of July 2019, 40 states use managed care models for Medicaid service delivery. As of June 2019, 24 states use managed care models to operate long-term services and support programs. MLTSS programs have typically served people age 65 and older or people with physical disabilities. However, it's important to note, states are increasingly enrolling individuals with intellectual or developmental disabilities into MLTSS. On the corresponding map, you can see in which states managed care operates. You can also see the states in which Consumer Direct Care Network provides services. What is the role of providers such as Consumer Direct Care Network, clients, and families in the Medicaid space? Consumer Direct Care Network is considered a provider in the Medicaid space. Medicaid contracts with a broad range of providers to care for clients, including hospitals, skilled nursing facilities, health centers, physicians, dentists, pharmacists, home health providers, and much, much more. Providers must meet state and federal licensing, contracting, and enrollment requirements. They must adhere to Medicaid program participation guidelines. Providers may contract directly with the state, MCO, or other similar benefit management entity. Everyone has a role in the Medicaid program. For clients, they must provide sufficient documentation to meet Medicaid eligibility requirements. They must also report certain changes in circumstance, such as income, household residence, or place of residence. They must also comply with Medicaid and MCO participation requirements, which can include enrollment procedures, coordination of benefits, cost-sharing provisions, and program integrity activities. But families also have a role in the Medicaid program. They can support and assist clients as needed to understand and comply with Medicaid requirements. And when possible, they may also provide care or other support to allow clients to remain at home. Consumer Direct Care Network plays an important role in the Medicaid program in the various states where we provide services. Simply put, states or MCOs submit a request for proposal to provide Medicaid self-directed services. Consumer Direct Care Network provides a response to these requests. If our organization is chosen, we begin the work of transitioning the program to CDCN. We contract with the state to provide services and negotiate a Medicaid rate for those services. We then become a Medicaid provider in the state. You probably heard a lot of information today and especially are unfamiliar with some of the terminology we might have used in this presentation. Here are just a few of the important words that will be important to your role at Consumer Direct Care Network. We hope these might be helpful to you. Thank you so much for joining us on this presentation of Medicaid 101, Understanding Medicaid. Please feel free to reach out to us with any questions on this presentation or if you want to know anything further about the Medicaid program. Have a great day and thank you so much for joining us.